As COVID levels continue to rise and our wastewater concerns being raised by health officials that an increase in case numbers is likely on the way here as well. Let's get the latest on COVID in the capital and what we should expect moving forward. Epidemiologist at the University of Ottawa, Dr. Raywat Deonandan. Good Monday morning. Thanks for your time.
Good morning.
All right, a lot has happened since the last time we spoke. What is on your radar? What's the most thing you're most worried about right now?
Speed of vaccination. We're getting doses, which is good. Getting a lot of hesitation now from people not keen on the new formulations, the Janssen and the AstraZeneca, and thinking about waiting until an opportunity to get a Pfizer or a Moderna shot comes up. Take what you can get. So we got to speed up vaccination enrollment for sure. And of course, there's a threat of a new variant, which we always talk about. And it's hard to quantify that because I don't think we have great data on that quite yet, but it's there. And so that is the race here. Can we vaccinate ahead of the likely rise to dominance of the new variants?
So let me talk about the speed. What are they not getting right if it's not happening fast enough for you? Who's dropping the ball here?
Well, originally, of course, it was supply.
Yeah.
Supply is at the core of all of this. If I don't want to point fingers, but whoever's in charge of getting doses needs to get more doses. Then there's distribution. Different provinces are doing it differently. And you hear ridiculous stories like the wrong people getting it ahead of 90-year-olds who are living in the community alone. I think we should focus on making sure that those most likely to be hospitalized and die are prevented from doing so. In addition, those most likely to be exposed against their will, like grocery clerks and police officers and things like that, must be hardened. Anybody else is second. Of course, doctors as well. I'm doubly concerned for community physicians, family doctors, and so forth, who seem to have been left out of this process. I don't know why, but they see patients all the time, and a lot of them are at risk, and they need to be folded into the process of delivering doses too. I'm enlightened, though enlivened rather, by the prospect of the Johnson & Johnson vaccine, because it can be delivered by family doctors and pharmacists, right? So now we're into that phase that we can have vaccine clinics coming out of offices and not just in hospitals.
Sounds to me like you don't think we've quite figured this out yet.
I think we had some bumps. Now, I'm an optimist, and I like to think that we've learned from our bumps. And I'm looking at the online registration portals in places like Toronto, which I've been investigating, and they're looking pretty good. Some are better than others. Like the one at Michael Garron Hospital, I'm so impressed by it. It asks things like, do you need help getting to the vaccination site? Is a second person going to set up the appointment for you? These are important questions to ask if you're a senior. Other sites don't have that. So bit by bit, we're learning from the best practices of other regions, which is what we should be doing. So I have faith, which is the wrong word to use, but faith is part of this, that in a few weeks those bumps will be ironed out.
All right, let's do a check on the variant numbers. Are they approaching as high as we had been warned, or are we doing okay at this point?
It's hard for me to tell. I've been trying to find accurate information on that, and I don't know. My sense is it's not quite as high as we thought it would be at this point, which is great, of course. But COVID as a whole is inching up there. So as you noted, the wastewater levels in Ottawa are scary. We're almost the way we were back at the peak of that second wave. And so in all likelihood, we're going to see a measured spike in cases here. And in Canada as a whole, we have a plateauing of cases, as best as we can tell, which probably means a rise because things are really plateau here. So that third wave looks like it's about to start. The big question is, will it be a high third wave? And will the third wave of infections be followed by a third wave of hospitalizations and deaths? And if vaccination is doing its job, that second part is quite questionable.
It seems that projections we never meet. And I know it's always you take the added measures because of the projections, so we avoid the crash, as it were. That being said, I mean, is it possible if we continue to go the way we're doing, because the cases have kind of gone steady here, at least locally, that we could avoid going into the red zone, lockdown, and just ride this out as we are now?
It's always possible. Right, which is why we advocate for maintaining some stringent behaviors so that we can maximize the probability of that outcome. Right, so models are a warning; they're not a forecast necessarily. I will push back at it and say that in the fall, the models underestimated the caseload that we eventually saw. So sometimes they undershoot too. So yeah, absolutely, we can avoid the size of the third wave by doing all the right things. Yeah, we're opening up. Okay, fine. But it doesn't mean we have to be irresponsible in our individual behaviors. It doesn't mean we have to let down our guard. And we can, again, ramp up vaccination, especially for the right people.
So they're saying by Canada Day, everyone should be able to get a shot in this province. Is that when, month of July, August, things are going to return to normal once we have our first shot?
I think you'll start seeing some signs of normal, absolutely. I think you'll have gatherings, barbecues, absolutely, maybe some indoor gatherings too. Now, the reason we want people to have some mitigation tools still in place, like mask wearing and distancing, is that the vaccinated might still be able to pass it on to the unvaccinated, at least to some extent. And so we have to maintain these mitigation tools until the disease peters out, because we want the existing infection not to pass on to a new generation of the infected. So the mask wearing and mitigation, it isn't interminable. Once people are vaccinated, those additional steps will fall away in time as well. We just have to stay with it. But to answer your question directly, summertime, we will see a return to socialization, I am sure of it. The extent to which is still yet to be determined.
Dr. Raywat Deonandan, epidemiologist at the University of Ottawa. It was good to talk to you. Thanks for your time this morning.
Thank you.